The purpose of this presentation is to familiarize you with what the OASIS is and isn't and provide an overview of the CMS scoring rules to ensure that we capture all the data accurately. The OASIS is incredibly complex, and while it is written in English, many times we find the OASIS has a language of its own. So what is the OASIS exactly? It's only part of the comprehensive assessment. The comprehensive assessment includes these OASIS data elements, but also the clinician's assessment of the patient's health, whether it's a nurse or a therapist reviewing the patient. The elements were designed so that there could be a comparison between a patient's outcomes from the beginning of an episode to the ending of an episode. Any questions that start with M, J, or G are part of the OASIS. And all responses must be supported by documentation. Therefore, the physician's medical records that are sent over, as well as the clinician's evaluation notes, must support the OASIS scoring items. So what is the OASIS used for? Many different measures, from outcome-based quality measures called OBQI to outcome-based quality monitoring, OBQM, monitoring potentially avoidable events, process measures, home health compare, the star ratings, impact act measures, from PPS to HER calculation to the new home health grouping model, and home health value-based purchasing. There's a significant amount of information that is used from the OASIS that impacts a home care's quality and performance measures. So it's critical that we score these items correctly. So looking at the time frame under consideration, the time period is going to be usually the day of the assessment or 24 hours preceding, based on the item guidance. This is for most of the OASIS items, with exception to several that you will find in the OASIS. For example, 1242 pain looks at recent pertinent past and would go well beyond the 24-hour time frame. So you must read each item correctly. Usual status means if the patient's ability varies on the day of the assessment, you're going to look at what is true for the patient greater than 50% of the time during the assessment time frame, unless there's a different item specified within the OASIS item. So if you're looking at 1810 upper body dressing, you're going to look at what they're going to be doing more than 50% of the time, and that's how you're going to score them. So one important concept to note is that anytime you step into the home, you change the patient's environment. So when you're scoring all these OASIS items, it is before there's been any type of intervention. That includes education. So if you perform some form of education during that first visit and now become able to do a task, you must score them before you did that. And this is a very important concept that often clinicians have trouble remembering. Taking a look at what defines a quality episode and looking back items, an OASIS defines a quality episode beginning with a start of care or resumption of care and ends at either a transfer or discharge. For some of the OASIS items, you'll be instructed to look back to the most recent start of care or resumption of care to identify if an intervention has occurred. It's important that interventions in education provided by any staff over the course qualifies during that episode, not just the care that you provided. So be sure to make sure you take the entire clinical team into consideration when scoring these items, particularly on discharges, to show that there was value for the service that we provided. Assistance is defined as what is provided by another person. One important thing though, assistance is not just physical. It can simply be just standing by, providing verbal reassurance. It's not just putting hands on a patient or getting equipment. So it's important to keep in mind that you must look at all types of assistance that are being provided. We want to minimize the use of NA or unknown unless they are truly correct responses. Why? because these answers, even though they're appropriate in some cases, they eliminate data points in comparison for home for star ratings as well as value-based purchasing and looking at outcome measures. So it's very important that these answers are not utilized just because we didn't assess an item. Medicare expects that we will be assessing patients from head to toe. Also using unknown, even though it's a frequent response with hospitalizations, it's important that we do try to find out why patients were hospitalized and drill into this information so we can learn what we can do to better keep people from having to be readmitted. So make sure we gather as much information about the patient as possible on the admissions and regular visits. In addition to our previous comments on the prior slide, a big part of what home care is meant to do is keep people at home and safely. So when a patient is hospitalized or uses a hospital ER department during a 30 to 60 day period of home care, is considered less than optimal services. It has a negative impact not only on our patients, but as well as home health value-based purchasing. So we can't prevent these unless we know what's going on. So it's very important that we get all the information so that we can manage this part of home care appropriately. So how is data gathered during an OASIS? This is through observation and interview, and these can be combined to get the best picture of the patient. The preferred method is always direct observation. So anytime you're assessing a patient, always choose that method. Interviews are acceptable, and this can be done not only with the patient directly, but also caregivers as well as fellow clinicians who have seen the patient. Keep in mind the cognitive status of the patient if you're doing interview strategies, as well as some people are embarrassed to tell you how really they're performing. So make sure that you take all the information into consideration before you score those OASIS items to make sure we have an accurate picture of the patient. In regards to scoring the ADLs and IADL conventions, a couple key points of information are ability, not preference or willingness, is what you're scoring the patient on. You don't want to overlook cognitive as well as emotional limitations. So if somebody's very afraid to get in the shower, but does have the ability, that fear is a real issue, and you do have to take that in consideration versus someone says, I'm just not going to do it. That's more willingness. So make sure you're assessing those items on their ability and looking at safety. Safety is key. Safety equals ability. If they're not safe, they are not able. So ability refers to level of assistance, if any is needed at all, to keep them safe. So when you're scoring these 1,800 items, it's very important to remember, you're going to pick the answer that would show that what would be the safest way for this person to have this performed, not what they're actually doing. So make sure you consider safety when you look at that. And caregivers, while the presence or absence of them in the home may impact how well they do, it does not impact OASIS scoring. So for example, you may say somebody is ambulating with 1860 as a 3, that they require somebody with them at all times, but because there's nobody living with them there, you don't think you can score them. That's incorrect. They're not looking at who's in the home or who's available. They're only looking at what the patient's able to do safely. So in that case, they may need somebody to be there, and you would score them accordingly. So people in the home does not make a difference on how you score these items. Continuing with ADLs and IADL conventions, what is included or excluded? Only look at those items that are included in that 1,800 or that functional scoring. So for example, grooming does not include hair washing, neither does bathing. So you're not going to consider that as part of that item. Make sure that the majority of the task rule, that if it varies between different tasks, you're going to look at the majority of those tasks the person's performing. So for example, if they're buttoning their shirt very infrequently, but are putting a shirt on over their head, grabbing it out of the drawer, that's the majority of the time. You're going to look at those types of tasks more, since that is what the person is doing majority of the time. And note that on the GG items and 1800s, they do not necessarily match, because there's different item intents of these two different OASIS scores, OASIS conventions. So make sure that you're looking at these OASIS items individually and don't be thrown off by them, maybe not always matching how you would score them. Medical restrictions are considered when you're assessing these items. So if a doctor has ordered the patient not to, for example, lift their leg, you must consider this affecting their ability during whatever the 1800 you're looking at. Even if they're able to do it, they're unable because the restriction trumps that ability. In addition to looking at other OASIS scoring items, you can go to Chapter 3 of the OASIS Guidance Manual, which you can find on CMS's website to have a detailed explanation for any of the OASIS information we're discussing today. There's also CMS Q&As, which are able to help clarify different questions that come up on certain items. And the source for all this information from today's conversation comes from Chapter 1 of the OASIS Guidance Manual.